A recent study published in the Journal of American Academy of Orthopedic Surgeons Global Research and Review aimed to identify an association between preoperative vitamin D levels and postoperative complications in arthroscopic rotator cuff repair, RCR. Rotator cuff tears are one of the most common injuries worldwide. Yet it is difficult to predict which patients will have poor outcome after arthroscopic rotator cuff repairs, RCR. In short, patients undergoing arthroscopic RCR with preoperative 25-hydroxy vitamin D levels were reviewed. Patients were stratified into 25-hydroxy vitamin D sufficient, more than or equal 20 nanogram per milliliter, or 25-hydroxy vitamin D deficient, less than 20 nanogram per milliliter, categorized and examined for development of postoperative complications. The results revealed that 229 patients out of 1,881 patients were 25-hydroxyvitamin D deficient, 12.2%. After adjusting for age, sex, and Charleston comorbidity index, 25-hydroxyvitamin D deficient patients had increased odds of revision, RCR, and stiffness, requiring manipulation under anesthesia. Rotator cuff tears are one of the most common and costly injuries worldwide. Some studies estimated a prevalence of 20 to 34% in asymptomatic general population, with incidence increasing to 64% in patients with shoulder pain. Shoulder arthroscopy likely accounts for a notable portion of surgical expense and remains the technique of choice for rotator cuff repair, given favorable, though variable, patients' reported and functional outcomes. Despite these positive results, studies have found a number of preoperative risk factors for arthroscopic RCR failure, ultimately drawing into question which patients are surgically optimal candidates. Recently, 25-hydroxyvitamin D has become a popular topic of investigations because its benefits to musculoskeletal health are believed to extend beyond bone mineralization. Studies have found that 25-hydroxyvitamin D deficiency may be associated with decreased bone and soft tissue healing, as well as dysregulation of inflammatory biomarkers. Some studies report as high as a 22 to 36% rate of recurrent tears after arthroscopic RCR. In turn, this has stimulated the need for augmentation of the procedure with recent development including dermal allografts and scaffolding to create more stable biomechanical constructs. Similarly, the role of supplementing 25-hydroxyvitamin D in these repairs is under consideration because it has been shown to mitigate the inflammatory milieu with reports to improve healing in animal models. Theoretically, this implies that a lack of 25-dihydroxyvitamin D could promote an environment hostile to adequate repair and predispose the patient to increase postoperative complications. Some studies have also found that 25-hydroxyvitamin D may have a role in preventing post-operative surgical site infection because it is believed to have a role in upregulating wound closure and the innate immune system. Specifically, 25-hydroxyvitamin D interfaces with the vitamin D receptor to transcriptionally upregulate epidermal stem cell phagocytosis and other antimicrobial peptides. Together, this may effectively minimize the risk of surgical site infection and supports the notion that repletion of 25-hydroxyvitamin D may be a modifiable preoperative risk factor to minimize adverse outcome in surgery. Interestingly, a previous study by Hedge in 2016 supports this hypothesis because they noted that 25-hydroxyvitamin D deficiency was associated with an increased risk of adverse post-operative complications after total knee arthroplasty. The purpose of this study was to further explore the benefits of 25-hydroxyvitamin D in arthroscopic RCR by using a large administrative claims patients registry to examine the relationship between preoperative 25-hydroxyvitamin D levels and subsequent surgical complications. Patients who underwent arthroscopic RCR between 2007 and 2016 were identified, with identification of preoperative plasma 25-hydroxyvitamin D levels within the 90 days preceding the procedure. Those who were 25-hydroxyvitamin D sufficient were compared with those who were 25-hydroxyvitamin D deficient against a series of post-operative surgical complications. Surgical complications included revision RCR, surgical site infection requiring incision and drainage, arthroscopic debridement, revision to arthroplasty, and stiffness requiring manipulation under anesthesia. Patients' demographics such as age, sex, geographic origin, other medical comorbidities, and Charlson Comorbidity Index were also collected. Between 2007 and 2016, 1,881 patients undergoing arthroscopic RCR had measured preoperative 25-hydroxyvitamin D levels in the Humana database. Of this, 229 were found to be 25-hydroxyvitamin D deficient. Most cases were reported in the South geographic region. Both 25-hydroxyvitamin D deficient and sufficient groups were similar in distribution and had a median and mode age in the 65 to 69 years group. In addition, sex distribution was equivalent between the two groups. The 25-hydroxyvitamin D deficient cohort had a higher comorbid rates of diabetes mellitus, hypertension, obesity, and cerebrovascular disease. The most common complication after arthroscopic RCR was arthroscopic debridement, followed by revision RCR, and stiffness requiring manipulation under anesthesia. Risk of post-operative surgical site infection, arthroscopic debridement, and conversion to arthroplasty were not statistically significantly different between the two cohorts. Retear or incomplete healing of the rotator cuff is common after RCR, although it may be of questionable clinical significance. Some studies note that the structural integrity of an RCR does not correlate with clinically notable differences in strength or pain, and patients will often report functional improvement despite failure to heal. As such, revision is often reserved for patients with persistent functional deficits or intolerance level of residual pain. These outcomes, though likely multifactorial, could theoretically be affected by 25-hydroxyvitamin D deficiency. Stiffness in the shoulder can be a direct result of post-operative inflammation, because the upregulation of cytokines in an inflammatory response is thought to lead to myofibroblast-induced capsular hyperplasia and fibrosis. This subsequently decreases capsular volume and limits shoulder range of motion. Although speculative, 25-hydroxyvitamin D may have a role in this pathogenesis secondary to its role in inflammatory regulation. Some studies have highlighted 25-hydroxyvitamin D's ability to inhibit microfibroblast activity, and it is believed that supplementation of this nutrient may have a role in preventing fibrosis and scarring. As such, the increased incidence of stiffness in the 25-hydroxyvitamin D deficient cohort may be explained by uninhibited myofibroblast proliferation, leading to increased scarring and decreased mobility at the glenohumeral joint. The authors conclude that vitamin D deficiency is associated with a greater risk of post-operative surgical complications after arthroscopic RCR and may be a modifiable risk factor. They suggest further investigation on preoperative vitamin D repletion. Thank you for your attention, and thank you for your like, comment, and subscription.